My name is Christine. I'm a registered nurse here at EIRMC. I work in the NICU, and I'd like to talk today about how to bond with your NICU baby. Having your baby in the NICU can be very scary and very overwhelming, but there are ways that you can bond with your baby, and I'd like to talk about those ways today. One of the most important things you can do to bond with your baby is to just be a big participant in the care of your baby for that day and ask your questions and be involved with the changes and different things that are going on. One of the most important times of the day is rounds. Everybody is there to talk about your baby. The neonatologist, the pharmacist, the occupational therapist, nutrition, the nurses, the neonatal nurse practitioners. Everybody's there to answer your questions and to discuss what is the next best step for your baby. The next step in bonding with your baby is through touch. Each baby is different and in different stages as far as how sick they are and different things that are appropriate. It's good to have a strong communication with your nurse and to discuss what is and isn't appropriate for your baby. So once you've communicated with your nurse for that day on what's appropriate for your baby, one of our favorite things to do is hand hugging. And this is when you can reach your hands into the isolette and kind of create a swaddle effect for your baby. You can put one hand on baby's head and one on their body and kind of just give not a hard pressure but a firm pressure. Or you can put it on the body and the legs, and again, same firm type of pressure. All of their nervous systems are very immature and young, so a lot of stimulation is not the best thing for your baby. So no rubbing and no patting, but this firm swaddle, they really seem to love. Another great way to bond with your baby is to go skin to skin, or what we like to sometimes call as Kangaroo Care. After you've communicated with your nurse for the day and make sure that this is appropriate and that your baby is stable enough to do this, it's great to take the baby out naked and place him or her skin to skin on your chest. You can either put her down your shirt or you can get a gown and we can give you a gown and you can do that. They stay plenty warm. It's been proven that it does help baby and it also helps with the bonding. Dads also can do this, and it's a great way to have baby also bond with dad. Another great time to bond with your baby is during care times. And care times regularly every 3 hours, give or take your baby's situation. And these are the times that we like to save for nurses to do their assessments, to do any lab draws, or anything that needs to be done on your baby at this time. And it's a great time for mom to get in there to help change the diaper or take the temperature or be hands-on with her baby. And there's a lot of teaching that we can do at this time to help you feel more comfortable with your baby, because it is scary having a sick little baby. One of the tougher situations in the NICU is when the mother cannot be with the baby. Sometimes we'll have mothers deliver out at neighboring hospitals where mom has to stay and recover and baby comes to us. Or mom has a job and can't be there all the time. It's really difficult to be at the NICU 24/7, and we understand this. And it is heartbreaking when mothers have to leave and be home without their baby. And there are different ways that you can still bond with your baby even though you're not there. One of the best things that I've found talking to a lot of my mothers is they take a lot of pictures. They'll take the pictures either on their phones or they'll make hard copies and put them up all over at their homes, and they will look at baby when they're pumping, or if they're siblings they can talk about baby and actually have a visualization for their other siblings. And another way that you can bond with your baby when you're not there is you can Skype or FaceTime your baby. You can actually see your baby and visually see that your baby's doing okay and bond with your baby in that way. Our job as NICU nurses is to take care of your baby, but it's also to help you feel comfortable and to help you bond with your baby. You're a very important part of this process, and if you ever have any questions or need to feel more comfortable, please come to us.